Hi, my name is Gina and this is Scott, and we're physical therapists for Wheaton Franciscan Rehabilitation Services. And today we're going to just go through the 4 different ways that you may have to use crutches after surgery, any surgery that you may have on your leg. So what we're going to do first is just kind of explain some general things that you need to remember about crutches. So you want to make sure you're standing up nice and tall, and you have about 2 to 3 finger width between your armpit and the crutch. And you want to make sure that as you walk, you're putting the weight through your hands and not through your armpits as you go along. So the first one we're going to show you is weight bearing is tolerated. So what that means is you can put as much weight through your surgical leg as you can after surgery. So to start with that, you're going to go crutches first, and then you're going to go with your surgical leg and then your non-surgical leg. And as you go along, you may be able to put more and more weight on the leg after surgery. And just notice how he is putting more of the weight through his hands and not through his armpits as he walks. And if you can, you want to try to step through with your left foot as you walk. The next technique we're going to show you is toe touch weight bearing. So what you're going to do, it's going to be similar to the last technique, except you're only going to put your toe down as you walk. So you're just going to not put weight through the toe, just kind of put your toe down as a point of contact with the floor for balance. The next technique we're going to show you is flat foot weight bearing at about 50% of your body weight. So what you're going to do is you're going to do crutches first and keep your surgical foot flat as you walk, and then move your other leg. So it's crutches first, your flat foot, and then your other leg. And you want to make sure that you're only putting about half the weight through that surgical leg as you walk. This is good for anyone who's had a hip surgery, mostly arthroscopic hip surgeries. The last technique we're going to show you is non-weight bearing. So what that means is you can't put any weight through your leg as you walk. So what you're going to do is you're going to keep that surgical leg in the air, and you're going to move with your crutches and then hop through with your opposite leg. And you want to make sure that you keep that foot in the air so that you protect your surgery as much as possible. And be a little cautious as you walk, because this is a little more challenging on your balance than the other 3 that we showed you. I'm Gina and this is Scott, and just remember that physical therapy is important in your road to recovery.